Today I'm joined by Steve Craig, Vice President of Sales at Solmetex. Steve, thanks for being here.
Thanks for having me. I appreciate the opportunity to have a conversation.
Amazing. Let's get into it. So, how do you find yourself in this position? Was it always the plan?
I don't know if anything's always the plan. I knew I wanted to get into sales from an early age. I have two brothers. I was riding around in a car with my dad one day, who was an entrepreneur, and he kind of said to us, he drove us in probably the nicest neighborhood of our town, and basically said, "What do you think most of these people do?" And being young kids, my brothers and I kind of said, probably doctor, lawyer, dentist, those type of things that everyone thinks of. And he said, now probably most of these people are probably in sales, and they probably sell things you would never think someone would actually sell. It's a great living. It's a great way to do things, and it always stuck with me. So when I graduated college, I decided I wanted to get into kind of healthcare sales, and found out pretty fast right out of college. Back when I graduated, they didn't hire people straight out of college for healthcare sales. So everyone told me, go look at payroll services, life insurance, office equipment, those type things. That's who I started interviewing with to get that sales experience. And I ended up taking a position in office equipment, planned on being there for 6 to 12 months to get my experience. Like everybody that goes to those type of opportunities, get some good sales training and things like that, and then move on. I don't know if it was fortunate or unfortunate, but I guess I was pretty good at it and worked my way up throughout the organization, stayed there 5 years, but it's truly where I learned how to hire, develop, and train people. So, after a while, that's what you're constantly doing. It's kind of a revolving door in those businesses. That's when I went back to my original career path of getting into healthcare sales, got a job in ophthalmology, spent about 8 years there doing everything from, a pharma rep to an OR rep to a little bit of managed care to eventually leadership. And then I received a phone call one day because we were kind of building out the DSO space in ophthalmology and the surgical center side of things. And Johnson & Johnson reached out to me and wanted to know, based on that experience, would I be interested in helping build out the DSO space for Johnson & Johnson. So I took that opportunity. A friend of a friend is how I found it. And I believe relationships is a lot of it. Worked on a team that kind of developed that DSO space, which is large group practices owning anywhere from 3 to probably the largest in the US right now is 2,000 offices, and really building out that space. Then got tapped on the shoulder to move more into leadership, getting back to building teams and managing teams. And then it just so happened I received a phone call from my original CEO at J&J. He left to a different dental organization and then came back and said, "Hey, I'm became the CEO of a company called Solmetex. They play in the water space, and I'm getting ready to buy 3 other companies and merge 4 into one, and none of them have a presence in the DSO space. Would you be willing to join the journey all over again and do it and build that space for us?" So myself and a peer did that for about 2 years of building out that space, and then once again got tapped on the shoulder to go back into senior leadership and build out teams and do that. So that's what I'm currently doing is leading teams across the U.S. and Canada. Inside, outside, enterprise is kind of how our organization runs and kind of where we play in calling on dentists in the private practice section, and then also calling on the DSO space. So that's currently what I'm doing right now.
So you've really been up and down the ladder, left, right, and center, done it all, eh?
Tried to. I think, it's in my belief, it's all about the journey. So, on the tombstone, it's about the dash, not the dates on the front and the end. I don't know if you know Cameron Harold. He runs the COO network. And I think, he says it best. It's a little morbid, but I think there's a lot of truth to it that none of us are getting out alive. So at the end of the day, we're kind of all just walking each other home. So why not have the best time at it? So I'm a big believer in, you got to enjoy the journey and really give more than you take. And things will work out well. And it's all about people and who you surround yourself with. I'm a big believer in the Jim Rohn quote: "You're the average of the 5 people you hang around." The only thing I'd probably disagree with Jim a little bit is we probably all fall to the lowest combinator of that 5 of the group. So you got to try to work to always elevate yourself to better rooms and be a lifelong learner and really try to develop yourself, because at the end of the day, we're all like trees. We're either growing or dying.
Couldn't agree more with you right there. So speaking of this journey, where do you see the professional side of it ending?
In what ways? You mean my career or just sales in general, or what are you looking at?
Your career, sales in general, your current company's position. Really, what's your goals?
I mean, our goals is to drive growth in the dental space when it comes to compliance and dental unit water. I mean, water is probably, it's the number one used instrument in dentistry. You can't do any procedure without water. And where we really work with groups is how do you compliantly make sure you're testing, shocking, and treating your water. Unfortunately, in the US, about 70% of offices don't do that. They just hope that the water coming in the practice and traveling through the practice is good. So we spend a lot of time not only to help the patients that come in those practices, but also help the teams and help the environment. So we're the only organization that handles water in, through the practice, through the patient, and out of the practice. Everybody else just touches a little piece of that. So that was kind of our vision. Our mission was, how do we take all that on and be the best at it, have the best products, but also be the easiest to work with and make sure that they are safe, they are compliant, and making sure no one gets sick. So our goal is to really drive that into more practices and get that changed, where more people are testing, shocking their water. Solmetex primarily handles amalgam capture, vacuum line cleaners. There's federal laws that you have to track and capture your amalgam because, outside of massive major industry, dentistry is the number one pollutant of amalgam in the waterways. So we work on that end to really help with that. Again, on the testing side, we work to make sure that they're testing their water, shocking their water lines and maintaining those water lines. And that would be a company called Stericycle. And then on Dry Shield, it's isolation dentistry. Prior to COVID, we thought that all aerosols in a dental practice came out of the patient. What we learned during COVID through the CDC studies is 78% of the aerosols are coming out of the dental unit water lines. And if 70% aren't making sure that they're testing, shocking, and treating those water lines, it now explains why dentistry has a high rate of eye infection, ear infection, nasal infection, upper respiratory infection, because you're breathing in contaminated aerosols all day long, every day you work. So we really work with groups of how to protect your teams. There's also a lot of time savings and staffing shortage savings with those products. And then we have a whole other side of our business, which is implant dentistry. And where the kind of the correlation works is, if you're in a true surgical center, you're using saline, you're using controlled water and things like that. But most of your everyday dentistry is not that way. And if you're using contaminated water, do a socket preservation or do a pulpotomy or things like that, you're opening up the bloodstream of that patient to contaminated water, which is not a great thing. So we kind of work on, one, getting the water in the correct side of things, but also two, work on showing them a more effective way to do socket preservations with a product called Ostrogen, which is the fourth company we own, which is Implant. So that's a lot of what we're doing right now, is really coaching, consulting, and we play a lot on the insurance compliance side of things. So obviously everyone wants to talk about EBITDA and growing revenue, but this, the best way to make those EBITDA dollars strong is to cut costs. So that's where we work on is cutting the cost side of things, both labor and products and procedures, to allow those EBITDA dollars on revenue grow even stronger.
That was a lot. So, from my understanding, your company basically ensures that everything from the water, what comes out of the patient, is as sterile as possible, right?
Correct.
What does that process look like? Like, how do you actually get into the room with these doctors or surgeons in the first place?
Well, a lot of it's just, having the conversation. It's a whole team effort, from our social media team to our inside team to the outside team to the enterprise team, of having those conversations. I also think, the world's changed. I mean, everything's at your fingertips, but everyone says that. In 1910, when you can find publications when the Sears catalog came out, that they said, sales is never going to be the same because the buyer is so educated now by having the Sears catalog. Well, everybody says that every single year. But, there is a lot more at the fingertips of buyers today. So there's a lot of information out there. There's water outbreaks that are happening constantly across the US for patients getting sick or, losing jawbone or losing teeth. Or unfortunately, the largest case in Anaheim was around kids with pulpotomies. And, they were put on antibiotics that are used for leprosy. It's going to change unfortunately, those kids' lives. And it's all preventable if you're walking through the process of testing your water lines, shocking your water lines, and treating your water lines. A lot of that can be preventable. You're always going to fail some water tests here and there, but as long as you're putting the right procedures and policies and SOPs in place to protect that, it's a great thing. So we work a lot with just having conversations, whether it be on LinkedIn, whether it be outreach to customers, whether it be at conventions, all different types of ways to have those conversations. With more information getting out there in the public, I think we're also having a lot more customers contacting us looking for help on that side of the business. Because a lot of times when you think about either evacuation lines or dental unit water lines, those are all things that are in back rooms, out of sight, out of mind. You assume the water coming in your practice is great. I'm sure everybody in Flint, Michigan which is the largest case in the U.S. that people know about it, of contaminated drinking water. They all thought it was great, and the city was taking care of everything. Unfortunately, some things happened, some bad actors were involved, and look what happened. So that's where we're trying to protect them both on what comes into their practice, but more importantly, it's what happens to the water traveling through the practice. It's not just the water coming in. You're talking about thin little tubing that carries that water all throughout the practice, which is a dark area. Dental practices aren't open 24 hours a day, so water is sitting stagnant, which is a definite breeding ground for biofilm, bacteria, and everything like that to take control. But if you do the right things of, starting out your day by, flushing the water lines for a minute or two, flushing the water lines every 30 seconds in between patients, and then making sure you're on a regimen and build out an SOP of testing your water lines, shocking your water lines, and maintaining your water lines, you should be in a good place. And more importantly, your patients should be in a great place. And that's truly what dentistry is all about. It's a people business. Most people don't really like to go to the dentist. Most people don't know the difference between a great crown and a bad crown, or a great bridge or a bad bridge, or anything like that. So if you take care of your team and support them, they're probably going to turn around and take care of the patients and support the community. So that's a lot of what we work with them on, is how to build out that process so you can have the safest practice possible.
Well, I just have to say off the bat, thank you for sharing those insights. I couldn't agree more with just about everything you said. Shifting gears a slight bit here. I'm aware
Sure.
that this time of year, a lot of medical companies are planning out their budgets for next year. And obviously, getting into these practices is very important. Well, how much of your budget would you say is allocated towards your marketing getting into these practices?
Yeah, I mean, obviously, marketing is a huge thing, both from the social media side, from the digital side, just from the outreach side. We spend a lot of time trying to get into the practices to make sure that they're safe and compliant. So it's a major focus of doing that, because if you're not helping the customers, then no one's benefited from it. Obviously, everybody is in business to make money, but we have a different type of mission of not only taking care of the patients, but also taking care of the environment. So we want to teach people what is the right thing to do. I end a lot of my talks that way is, if five frogs were sitting on a log and two decided to jump, how many are left? And most people are going to say three, but deciding to jump and jumping are two different things. So that's where we really work with the groups of building out that compliance portfolio, and really making sure it's implemented. And you're always dealing with people. People have to do that. But the other area we really work with them is, it's a lot easier to sign the back of a check than the front of a check. And when you deal with compliance, finances come into that. How financially obligated are you to building out a protocol? How do you want that to see? How are you going to control that? Is there somebody that's in charge of this? But at the same time, everybody's gambling appetite is different. I mean, when it comes to compliance, you're gambling. And unfortunately, we could walk on a floor in Vegas today and there's going to be somebody that walks in $5, and when it's gone, they leave. On the flip side of that, someone's probably going to mortgage their house, their car, and anything else they can get their hands on, and they don't want to leave until they think they're going to win the lottery. So everybody's gambling appetite is different. Everyone's financial appetite is different. So we really work with them is building out custom protocols that's going to work for them and their group and their practice to help them be successful. And we walk through the steps from building it to implementing it to making sure that it's followed. And what happens if there is a remediation that needs to be done because you fail a water test? Or what happens if a human error happens and someone just forgot to do something? We build out policies and SOPs for them. But I think we all know that if they're involved in that process, it's going to work tremendously. If we just tell them what to do, it's not their plan, it's not their mission, it's not their vision. So we really work with them in building out that custom protocol that's going to work for them and what they're going to be able to manage.
So your ideal customer here is a person in the practices here who actually really wants to work with you, right?
Preferably someone that wants to work with you. I mean, I think that's part of the problem with compliance. A lot of times, I always encourage to have somebody volunteer to own the process. Unfortunately, when it comes to compliance, most people are voluntold. They're going to control the process. And being voluntold to do something, you may not have your heart and everything in it. When you volunteer and you believe in this mission and you want to take it on for the group, for the practice, it comes out a lot differently in the end. And ultimately, there are, like I said, there's federal laws around capturing amalgam. We're starting to see states put laws in place for testing and shocking and treating water lines, because right now it's Washington in the U.S. and Georgia. California has legislation signed, and so does Maryland. We're going to see more of that coming on because there's just been too many outbreaks. When it can be avoidable, that's a great thing. But you also, like I said, have to have the SOPs in place and be able to show those if investigators would walk into your practice.
So what do you do when you find a customer and they aren't putting their heart and soul into it? How do you guys overcome that problem?
I think a lot of it is, we don't like really to go to scare tactics. It's kind of like we don't, publicly run out there and tell everybody that so many practices don't test and shock and treat their water lines. I mean, dentistry is an incredible business. I've been in dentistry for over 20 plus years now. It's a phenomenal profession, does a lot of great for the good. The mouth is the gateway to the body. So we want to make sure patients are coming into practices. Right now, prior to COVID, about 60% of the US population went to the dentist. Post COVID, it's down to about 40%. There's a whole host of reasons for that. Dental insurance really isn't dental insurance. It's a coupon, it's a subsidy. There's nothing to insure. If I have auto insurance, you know, if I'm State Farm, well, 3 cars are going to get in a wreck or stolen or catch fire, but I'm going to make my money on the other 97. Well, with dental insurance, every single person that walks into practice is going to be filing a claim, which is not really insurance. 50% of the people that have dental insurance don't even use it in the U.S. currently. So what we really try to work with them is building out your practice. What is your vision? What is your mission? What are you trying to accomplish? And then relaying that message back to them of what that is, why they got into dentistry in the first place, what they're trying to build. And then once again, if you take care of your team, the team's going to take care of the patients in the community. Fortunately, a lot look at, the patients are our number one customer, but your team should be. If you take care of them. So a lot of times we're just having those conversations. Are you going to win everybody? Absolutely not. Like I said, it comes down to financial and your gambling appetite. There's people that think they're never going to get caught in anything. So our job is to educate them, show them the best possible way to build out a protocol and the SOPs to protect that protocol. But at the end of the day, their name's on the door. It's their practice. They have the right to decide, do they want to do that or not? And not everybody should be your customer. I think probably what changed my eyes on a lot of that was I listened to a talk quite some time ago from the head real estate guy that was retiring from Burger King. And in my day, Burger King and McDonald's were the king of fast food. And they interviewed this guy and they kind of said to him, you just retired. David Goliath story. You were on McDonald's heels all these years. How did you do it? You guys were right there, right behind him in the second spot. And the guy kind of laughed and he goes, well, I guess I can tell you my secret now. I'm retired. I can't get in trouble for this now. He goes, we did absolutely nothing. I told my team to sit back, enjoy life, have a good time. All you got to do is follow around the McDonald's guy. And when he finds a location and they're going to put all their money, resources, and capital into that, obviously it's probably the place we should be. Buy up the site as close as you can get to them. Hopefully the other corner, the other side of the street, they're going to head south for work. They'll get them for breakfast. They got to head back north to go home. We'll get them for dinner. And it just tells you that there's so much business out there. Not everybody can be your customer. There are capacity issues, but that's why there is a Shell and Amoco in US on every corner. There's a Chase Bank and a Citibank in every corner. There's a Cane's and a Chick-fil-A in every corner. There's McDonald's and Burger King on every corner. There's enough business for everybody. You can't handle all the business anyway. One dentist right now sitting on a street corner in Chicago where I'm living, they couldn't handle every single patient in the United States. They couldn't even handle every single patient living in Chicago. You need competition. It's good for things. It makes you stronger, but there's no way to treat every single patient. There's no way that you could have every single customer. I'm sure Apple would love that, but there's a lot of loyal Android users, just as there's so many loyal Apple users. And that's a good thing. It keeps both of them honest and keeps them both trying to develop new products. That's what we're always trying to do. How do we figure out what's coming up next? What's the best way to approach something? What are the best products to help solve these issues? So as with everybody else, you want some competition to make sure you're on your heels. You don't want to follow the competition, but you want to make sure you know what's going on in whatever space you play in, and then play your own game.
So how do you guys make sure that you're always keeping at the top of your game here, staying ahead of your competition? I mean, do you guys even have competition in this industry?
We do. We have competitors in like each one of the little segments or product categories we play in. Like I said, we're the only one that is a full comprehensive end-to-end water solution. Other people play in one aspect of that. But we have a team, they go to a lot of the dental conferences, they're always out searching for what are new products, new ways of doing things. So we have a whole team that kind of works on that, of looking at what would be the next solution to make sure you have clean water lines. Is it something we don't even know about yet? So we're constantly looking at that. Constantly, we have engineering teams at our 2 plants in Boston and in Colorado that are constantly looking to make sure our products are up to snuff where they should be, make sure they're gold standard leading products in the industry, and making sure that there's no issues. If we like hair of product issues or failures or anything like that, that's where we get the tech team and the engineering team to really look at those lot numbers, look at what's going on to make sure that we are keeping our offices, our patients, in the environment safe. So, it's something you have to stay diligent on and always be working towards striving to get better. I mean, I think perfection is probably the enemy of great, but as long as you're striving towards that, you may never reach it, but you got to have that mindset. You got to have that self belief in what you're doing, what you're selling, and how do you improve other people's lives. I mean, I think the best way to look at sales is nobody wants to be sold, but they love to buy things. So I think the best way to go about things are figure out what are the problems that that customer has and how can your product solve that solution to help them. And there's times where it can't, and you have to walk away and say, I think you're better off here. You're better off doing this, or you're better off doing that. But I think that will come back to you tenfold instead of trying selling something that they truly don't need. But I think if you walk into calls with that mindset, that's what we try to coach and develop our sellers to do. You're going to be highly successful and they're going to want to refer you to their friends. So coming back to that average of five, they're going to want to refer you to their five friends who are going to refer you to their five friends. Because a lot of times they're going to have the same issues, the same problems, and need the same solutions. And that's the easiest way to build a reputation in a marketplace.
Couldn't agree with you more right there. I mean, one of the most crucial parts of sales, like you said, is knowing when you have to walk away. Not
Hmm.
everything has to be a perfect fit. I couldn't agree with you more, really. It's reminds me of a similar quote or sentiment I heard. Satisfaction is the killer of innovation. And,
Hmm.
you can't let yourself become complacent.
Yeah, I mean, there's too many examples of that. Whether it's Blockbuster Video, whether it's Kodak, you can go down the list of companies that got kind of happy with where they are. Quit striving to get better. Kodak invented digital film. They never did anything with it. Other people did that. You know, Blockbuster. When Netflix came in to try to do a buyout of them, they were opening like a store like every 16 minutes, and now they're defunct. And Netflix looked at a different way to look at the business and a different way to solve the problem of the customer to make sure they could get a stronger solution and a better solution, and we're willing to pivot and do things. But there are plenty of examples of companies that do that and are still in business because they were able to be nimble. They were able to pivot. They were able to move to different ways of doing things. So you always have to be striving to get better, or if you get stagnant, you can put yourself in a lot of trouble. And there's way too many examples of organizations that have done that.
I couldn't agree with you more. Well, Steve, I appreciate your time here. Few last things before we hop off. Where could our
Sure.
listeners find you if they want to get in contact?
Yeah, I mean, I'm highly accessible on LinkedIn. I post daily. I'm pretty active there. They can always contact me at LinkedIn. Our company website is solmetex.com. So it's solmetex.com. So it's pretty easy to connect with us there. And we have customer service numbers, all that type of stuff. But, I'm willing to help anybody. I believe we should be helping the next generation to get better and improve. So if anyone has any questions, concerns, whether it's on water, whether it's on sales and in general, I just had a meeting last night with a young kid graduating from high school that's looking to get into sales. So I think that's what part of our responsibility is, giving back to people as we are. And I think mentorship is a great thing, but usually the mentor gets more out of it than the mentee because you got to prepare and things. But I also encourage this individual that you don't have to meet your mentors. Figure out what you want to do and where you want to go. There's so much content out there with AI and everything else that you could never meet your mentor, but there's so much content you can do that. There's companies that do that now. I don't know if you're familiar with Gary Keller and Jay Papasan. They wrote the One Thing book. He owns, Keller Williams Realty, but he had a guy that worked for him by the name of Jeff Woods, and Jeff broke off on his own. And what he does is he teaches young founders and startup companies to build an AI board. So you could go do that. You could have Warren Buffett as your financial advisor. You could have Steve Jobs as your creative advisor. You go down the list of people you want. They could be on your board of directors. You're never going to meet them, but they have so much content out there. And through AI, you could ask questions and just go deeper and deeper and deeper and have this board of directors drive you on what's the best way to solve that problem or where to go. That's only going to get perfected more and more as we go. I mean, what happened yesterday in AI is going to be different than what happens today, and it's going to be massively different what happens tomorrow. So I think a lot of it is, going with that mindset that you want to improve and get better. No one's coming to save you. It's always you versus you. And you got to go out and develop yourself. Anything you get from an organization and the development side of thing is icing on the cake. But you got to go develop yourself. So if anyone wants to reach out, I'm pretty available on LinkedIn. Anyone has interest in improving kind of their water throughout their dental practices, like I said, solmetex.com is a great way, or reach out to me on LinkedIn, or my email is scraig at solmetex.com. And we can definitely get them in touch with the appropriate person that handles that part of the market that they're in.
Beautiful. Well, Steve, thank you very much for your time.
I appreciate your time, Jesse. Hopefully you have a great day.
You too.